I'm trained as a clinical psychologist. For the last 21 years, I have been a university professor primarily at research intensive institutions, where we're investigating, for me specifically, topics related to mental health for Black people, for other marginalized individuals, to be able to address culture and race and disparity and discrimination in meaningful ways. But the thing about mental health that's been a challenge is that people assume that if they say reach out for help, then that means they're weak or there's some deficiency about them. As you know, the single most important aspect of whether or not psychotherapy is effective is the relationship between the client and the therapist.
What is up, fam? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things psychology, wellness, and graduate school. We have a great video planned for you all today. This is a really valuable interview that I did with Dr. Rheeda Walker, and I think this is a really important topic that we are about to discuss. Dr. Walker is an award-winning professor, psychologist, and expert scholar. She has published more than 60 scientific papers. She's also the author of the bestseller, The Unapologetic Guide to Black Mental Health, which has been cited in or appeared on countless media outlets, including the New York Times, the Washington Post, Good Morning America, and The Breakfast Club, among countless others. And so I do want to give some background to specifically why this topic is so important, especially as future clinicians, in terms of what we should know about Black mental health. So the historical impact of slavery has really impacted a lot of institutions here in America. There are essential disparities between Black Americans and white Americans in multiple institutions. For example, there are healthcare disparities between Black and brown individuals. Black and brown people tend to face more barriers when it comes to insurance and also implicit bias from healthcare providers that can actually directly correlate to the quality care and treatment outcomes in those hospital and medical settings. There are criminal justice inequities. We see things like racial profiling, harsher sentencing, and over-policing of minority communities that result in higher incarceration rates for minority communities, and that just perpetuates that cycle of poverty. We see educational disparities, unequal funding. There are harsher disciplinary practices against Black students, and there are also limited resources in Black schools that are underfunded compared to white schools. There's also employment discrimination, so discriminatory hiring practices, unequal pay, and limited advancement or economic wealth that we can see in terms of those disparities among those racial groups. And then finally, there's housing discrimination, which could probably be the biggest institutional effect. The historical ramifications of redlining, segregation, has produced a lot of limited housing opportunities for minorities, and that only exacerbates the wealth disparities and perpetuates economic inequality, especially because so much wealth is in the ownership of a home. So when we talk about the why, these are all institutions that are impacting Black American, not just their physical health, but also their mental health as well. Increased levels of anxiety, increased levels of depression. And so if you're looking to become a clinician, if you're looking to become a therapist or a psychologist, I think it's really important to know some of these disparities that exist, and for the clients that come to you and the patients that are coming to you for help, to just be aware of some of those systemic factors that impact their physical and mental health. Please subscribe to the channel and think about joining the channel if you are looking for more content that we have not released yet in terms of some of the interviews that we've done. Follow me on Instagram. You can check me out at Phil's Guide to PsyD. Please like and share this video. Subscribe to the channel if you already haven't. We are going to jump right into the interview. All right, Dr. Walker, it's so great to see you. How are you doing today?
I'm good. I'm excited to be here with you for this conversation.
What has inspired you to become a clinician, to become a psychologist? I'm just kind of curious in terms of what sparked that interest.
It's been a circuitous route. I'll say that for sure. I was a first generation college student. And so I was really dependent on my mom, who gave me two respectable career options. One was law and the other was medicine. And I thought, okay, I guess I'll do law because I like to talk. But it wasn't anything in me intrinsically that wanted to do law. And as an undergraduate student, I had the wonderful opportunity at the University of Georgia to shadow a team of attorneys. And in doing so, I realized I don't think this is what I want to be doing. And so what I did was just kind of go back to the drawing board that was, all right, which one of my classes do I just love just for the sake of being in class? And it was psychology. And of course, at the time, people were saying you can't do anything without a PhD. And I didn't understand that there were lots of things actually that I could do. But I figured, oh well, I guess I'll just go get one of those PhD things. And that's just kind of how I honestly fell into psychology as a career.
That's incredible. I always love asking people about that question just because I think there's certain points in time that we all have that kind of enlightens us and helps make us realize how that path can be so clear. So yeah, thank you for walking us through your journey. I'm really excited to talk about Black mental health. I think your book provided so many insights for me. The Unapologetic Guide to Black Mental Health, which I'll definitely leave down a link below for people to check out. But I think it just really, I think, empowered me as a reader to really engage in some self-care items. So as we start, what do you think are some misconceptions or stereotypes about Black mental health that people should know about?
Those stereotypes will get us every time. Those old wives' tales, those things that we believe that have helped us to survive. In all honesty, but the thing about mental health that's been a challenge is that people assume that if they say reach out for help, then that means they're weak or there's some deficiency about them. We think that if we're not having a nervous breakdown, like if we're not broken all the way down, then we're okay. And there is so much in between those 2 points. Like, I'm doing fabulous and I'm having a nervous breakdown. Like, there's a lot of space in between that we have to be aware of. And a lot of us don't get the help that we need, that we could benefit from, because of the things that we tell ourselves, those misnomers about mental health, and also that it's for other people. So mental health isn't for Black people; it's for other people. Those kinds of things. And so I'm glad that, certainly since the murder of George Floyd and the pandemic, that there has been so much more conversation about mental health. We got a long way to go because we have a lot to overcome. But I think that, some of those stigma, that stigma is what we need to be able to just eliminate in order to get to where we need to be in these conversations.
I love that. I love that because I think it's yeah, it's so valuable. And even when we think about the forms of historical trauma that has plagued Black communities, the institutional forms of racism, what are some coping strategies for navigating those difficulties?
Well, one of the things that I think is easily accessible, and that seems to work, is taking stock of our mind, our physical body, as I know you're invested in, and just awareness of how our stress and strain is affecting us, not just emotionally, but also physically, and taking time to just breathe, sometimes. And my graduate students know that is one of my favorite things to do, is just to breathe, because it's easy, it's accessible, you can do it anytime, we just have to do it right, and understand that when we breathe, uh, um, what's the word I'm looking for? When we breathe with intention, that it removes us from these stressful situations that we have no control over, because that's part of the challenge, is that stuff is happening around us that we have no control over. But when we can center ourselves, get away from the thoughts of helplessness, and what folks are doing to us and what we can't do, that it creates a new path. Like, that's what so many of us need. It's like just kind of a new path, a new narrative, instead of doing the same thing that we've always done and hoping for a different result, which doesn't usually work. So that's one thing. I love for us music. We are a creative and spiritual people, and music drives a lot of that. So tapping into music before we know it. And then one of the other things, because I am a cognitively behaviorally trained therapist, being aware of our thoughts. and shifting our thoughts. And that's not to say that difficult circumstances don't happen, but 90% of those circumstances is what we think about them, how we react to them, and what we do. So those are some things that come to mind.
That's so valuable, and I think what you're mentioning is a lot of ways that clinicians themselves can also be aware of in terms of educating themselves. Actually kind of leads me into my next question with cultural competence, right? For therapists, for psychologists, for mental health providers who are dealing with diverse populations, racial, ethnic minorities. How can we ensure the cultural competence that's needed to actually provide quality care for people?
I think we might need to revisit even competence as a label, because there has been a history of like check boxes. Like, okay, if I just check this box and I go to this session and I get my continuing education credits, then I will be competent to provide the care. And if we can shift that maybe even to a disposition of humility, that people need to be constantly learning about communities that are different from them so that we can meet people where they are. And incidentally, I have a new book coming out. I don't think you know about this one. The No Racial Elephants in the Therapy Room will be out this May. So to help providers who don't look like us, to be able to address culture and race and disparity and discrimination in meaningful ways. Because oftentimes, as folks are uncomfortable talking about difference and certainly racism. But we have to be able to have those conversations in order to meet a lot of our clients where they are.
That's great. That's great. I think it's such a valuable, just the educational piece. And I've known some of my other supervisors have talked about cultural humility, right? Of just being aware of the biases that we have and that we're bringing into the therapeutic space. I know you are a full-time professor, and also you have worked with clients before, but are there any approaches or interventions that we can utilize in the mental health space specifically for Black Americans?
Well, the approach I think that's most important is hearing folks' stories. Because one of the challenges that happens, and we see it in some of our multicultural textbooks, right? That is, okay, with this racial group, we see this. With this racial group, we see this. And it's like you have this list. But we don't know the degree to which someone even identifies with that group. And when people come to therapy, they come to therapy with pain. They don't come to therapy as part of a group. And so they need to be able to tell the story of what got them to therapy and to hear it fully, and to not, certainly on day one, for people who are cognitive behavioral therapists, challenging clients' experiences. Folks have to be able to tell their story. And even potentially more important, or as important, is to be able to hear those sources of strength. For a lot of individuals who are, parts of marginalized groups, they've been hearing for so long, you ain't about nothing, you ain't never been about nothing, you can't achieve nothing, people who look like those narratives. And that stuff can get internalized to some degree. And so I always encourage therapists to listen for the thing that keeps that person going, the talent that they have. It might seem small, but that client, they're not even thinking about it. They've completely lost track of everything about them that is good. And when the therapist has an opportunity to point out that, you really do care about other people. You care about other people to the point maybe sometimes of sacrificing yourself, but we need more people in our society who care about others. So whatever the thing is that the person may bring in is maybe potential shortcoming, try to find the positive on the other side of it to help them see themselves, as a whole functioning, fully capable person.
I think that's so crucial. So it reminds me of elements of narrative therapy, right? In terms of telling the story. I am CBT trained myself, and I think one of the things about that I've learned recently is that it's not just about the reduction of emotional distress, right? It's not just about reducing anxiety or reducing high levels of depression, but really about sort of those strength-based approaches as well, like instilling hope, looking into self-compassion, gratitude. It's not just about taking away the suffering, but like what can we add to empower the individual, which I've gleaned a lot from positive psychology. And so I think a lot of what you're talking about kind of resonates with that for myself as well. In terms of intersection, so, this is a really multifaceted, complex thing when it comes to Black mental health because there are a lot of variables that are working. There's gender, there's sexual orientation, there's economic status. How do all of those things intersect with race and influence maybe some of the mental health outcomes for Black individuals?
So, that sounds like a whole book or 2 or 3. You know, again, it depends on the individual. And where we have to start as professionals is asking our clients, how do these different identities, play out in your life on a day-to-day basis? Because yeah, there may be someone who identifies as, a lesbian, a Black lesbian, but her being a lesbian is so much more meaningful in her identity and the spaces that that person chooses to be in than what it means for them to be Black. And so, as psychologists, we have to start with the assessment. Like that's where we always start. And so the assessment is with the client and asking them about what their identities mean to them. Because I just about guarantee you have 10 different people in a group and they may all seem to have the same intersecting identity and it looks different for every last one of them. But the common thread could be, the struggle of integrating those identities and the struggle of falling in the margin of those identities. And so, a lot of the work that I do, the research that I do is related to suicide vulnerability. And what we know about people who are more vulnerable is that they kind of fall in the cracks of their identities and don't feel connected to any group. And so it's important for people to feel connected, if they are strongly identify as Black, but they happen to be transgender, but then they've been ostracized by the Black community, that's problematic. And so the therapist wants to be able to help that person to feel connected and to be integrated in who they are, almost regardless of what society is saying to them.
And I know we kind of mentioned it a little bit in terms of some of the stigma in the Black community when it comes to mental health. What other barriers are there for Black Americans when it comes to accessing mental health?
Well, one of the reasons I wrote the new book is having access to providers. Most of us want to see people who look like us because we don't want to have to deal with the same stuff in therapy that we have to deal with outside of therapy. And so we need more providers who either look like us, because we're underrepresented, across mental health providers, whether it be counseling, social work, psychiatry, you name it. So we need more providers who look like us. And then we also need to have more resources to be able to access those individuals. And when we cannot access individuals who look like us, we need for the people who don't look like us to be comfortable talking about race and to be able to integrate the positive aspects of our culture so that the therapy resonates and so that it makes sense. As you know, the single most important aspect of whether or not psychotherapy is effective is the relationship between the client and the therapist. And so we need more therapists who are comfortable providing care because the most recent statistics that I have seen is that most, white therapists are not providing care to any Black people. And so some of that has to shift. At the same time, if somebody's not comfortable, I don't want them seeing anyone and pretending like they are. We don't need that. But we need more folks. We need more hands on deck to provide care that makes sense.
Yeah, what you're mentioning is reminding me of the community support in multiple different areas for Black individuals, and I think about even some of those support systems, not just even from the therapeutic space, but from their community, from their local community, from their family.
Mhm.
What are some of those cultural or social traditions that do promote mental well-being for Black individuals?
Well, this probably doesn't answer the question, but One thing that comes to mind for me where we could use more support, it's starting, it's, in its infancy, but it's from the church. It is absolutely from the church. I see the church as both a barrier and an opportunity for change. It's been a barrier because of the messaging in the community where someone goes to their family member and they say, "I'm feeling depressed, I'm overwhelmed." And the family member says, "Go pray about it." And that is a standard response. Go pray. And so can we take that another further, as my granny used to say? That is, go pray for a mental health professional. Like go pray to find someone who can help with the depression, who can help with the overwhelming worry and hopelessness. Find that person. And it needs to start honestly with pastors in a pulpit, the clergy, the leadership, because they need to be, integrating that messaging with sources of strength that is, prayer and fasting and go see a professional. It has to come from the leadership. And I think that until that starts to happen more, then the church will continue to be a barrier to getting more and effective mental health care.
That is so good. And that actually speaks to me directly because one of the things that I'm doing in my research is trying to see what are the religious, spiritual coping mechanisms that Black Americans are utilizing to protect themselves from stress.
Mhm.
And one of the things is that religious, spiritual, social support. It's already in the literature, but we also see it in a little bit with my research as well. And I think that is such a crucial thing in the ways that church and mental health can collaborate and actually work together. It doesn't have to be a one or either or approach. It can be a both and approach.
Mhm.
And yeah, I think it just inspires me, especially when working with patients, to be able to, who are coming from that religious spiritual background, to be able to talk about those things as well in the therapeutic space. So I love that you mentioned that. What advice? So my channel is geared towards people who are trying to become therapists and clinical psychologists. And so they're coming from all different backgrounds: high school, college, graduate school. What advice do you have for people in general who are looking to go into this space and are looking to work with this population, these marginalized populations?
Yeah, there's so much information on the internet now that didn't exist when I was looking for graduate programs and trying to figure things out. Um, Being able to and I mention the internet because I've been recognizing just in my own world and among my doctoral students that we can't always handle the volume of folks who reach out to us, for a specific input. But there are different texts available. Mitch Prinstein is someone who comes to mind and who I sometimes direct students to. He's at APA, he's at the American Psychological Association now as a research director, but he was a full-time faculty member at University of North Carolina, Chapel Hill for a long time. And he has a free PDF online that his graduate students over the years have updated where they talk about differences in, say, psychology and clinical versus counseling and social work. Like they talk about that. They talk about the importance of research and getting research experience even before someone gets into a graduate program in order to be competitive. And I actually have a YouTube video that talks about these kinds of things. I think at this point it's been viewed about, I don't know, 35 or 40,000 times, where I talk about these are the nuggets of what you need to be competitive for these programs. Because I do think it's unfortunate that a lot of times students, undergraduate students, and maybe even high school students may assume that, well, if I have good grades, and maybe if I have good standardized test scores, then I'm going to be competitive. But as an example, our program at the University of Houston accepts less than 1% of applicants who apply. And so I think there needs to be some insight that getting into these PhD programs, as an example, can be or is harder than getting into medical school. And so we need, a little bit more knowledge. Some of it is available on the internet. A lot of it is available on the internet, searching for how to get into grad school. A number of great videos are available that grad students have made on YouTube about their own experiences. So taking time, I think, to dig into other people's paths and what folks have taken time to specify on the internet about how to be competitive for these programs. And don't start senior year of college. As you know, start doing the research at least freshman, sophomore year of undergrad, or plan to take some time off in order to get ready.
I love that, and I think one of the things that was really great advice for me when I was looking to become a clinical psychologist was, yeah, being able to shadow and talk to these professionals themselves, talking to different psychologists who are in different specialties or niches, and just getting an idea of what they do on their day to day basis. Like we've mentioned with some of the stigma with, what exactly do mental health professionals do? What do they not do? I think just having that clarity can be so valuable as well. So, Dr. Walker, you've talked to us about a lot of really great nuggets of wisdom. What are your hopes for the future of Black mental health?
You know, I think about this a lot. And I'll say one of my probably pipe dreams, if I could wave a magic wand. And you talked about, being inspired in different ways by the Unapologetic Guide to Black Mental Health. It really is my hope that we will be able to develop more of a community of people at different stages of life, including individuals who have many more resources than you and I, who can dedicate those resources to, say, the pipeline, to helping high school students to think about psychology, undergraduate students to be funded to get enrolled into these doctoral programs, and then to have the support that they need going through the program in order to be successful. Interestingly enough, I earned my PhD at Florida State University. And I say that because Florida is having some DEI issues right about now. But I earned my PhD through a program that supported African Americans who were working on PhDs in different areas. So not just psychology, but history and science and you name it. And now, those kinds of programs are being compromised. But for me, I desperately needed that kind of support because we all came together once a year, to support one another and to be re-energized about why in the world am I working on this PhD? Why am I even here? Because we need that kind of encouragement, especially for those of us who are the only one. You look around the classroom and you're the only one in there. And so it's nice, as you know, for us to be able to come together as community. But we need folks who are outside of, who aren't working on their degrees, who've obtained a certain success in life, to be able to redirect some of their resources to kind of building up the pipeline. Because I do see a pretty, meaningful pipeline issue. You talked about how can we help students who are thinking about these areas. There's a lot of holes, in the pipeline. There's a lot of holes. And so we need support to help to expand the pipeline in ways that were intentional. I'd say more so in the '80s and '90s, early 2000s, but seem to me to have fallen off, in the last honestly, certainly in the last decade.
That's beautifully said, because I think it's not just sort of the issue of, like, for me, I wasn't really even aware of clinical psychology until my third or fourth year of college, right? And just becoming more aware that that's even an option to me, even in high school, I think is significant. And then realizing, okay, what are the barriers? What do I have to do now to start getting to that point? I think is such a long road ahead, and so I really appreciate you sharing that. What for you? How do you practice self care? Because I think as clinicians or as full time faculty members, and we're working in this space and we're trying to help people with their mental health, and we're pouring so much out. But for you, how do you give back to yourself, whether physically, mentally, spiritually? Yeah, I would love to know.
Yeah, that's a great question. I ask myself sometimes that very question. And what I am honest about is that it really ebbs and flows for me. There are weeks where I have, so many deadlines and so many commitments that I'm just like, okay, we'll work on that self-care next week. And I do set my schedule up in such a way that I make sure I'm not piling on all the things all the time. So there may be, say, a week here, like I said, a couple weeks there, where I'm working on big deadlines, and I know that there is a time coming where I'm shutting it all down and I'm not doing any of it. And so I'm really very intentional about my schedule. Now, when I'm in the thick of it, I am someone who, I light my candles, my favorite candles, and I sit and I breathe, and I focus on, okay, what are the things that are in my control? What are the things that are out of my control? Because when we're trying to, do too much, sometimes we're doing things that we don't even have any right doing, right? And this is especially true, I think, for high performing, high functioning people, because we're like, well, I should be able to do all these things, right? And should isn't really a part of my vocabulary, but sometimes I just function in that way. And so, there are times when I do have to kind of send out the SOS to my friends, to my family, and I'm like, look, this is what I need right now. And I'm very specific. And some friends who know me just drop off a cupcake. They're like, okay, they just put a little treat on my porch, and I love them for it. And amongst my friends, we check on each other with regard to our psychological fortitude. That was the phenomenon that that I introduced in the Unapologetic Guide to Black Mental Health as kind of a rating, so that we don't ask each other, "Well, how are you doing?" Like, that doesn't tell you as much as on a 0 to 10 scale, how are you functioning? Where's your psychological fortitude? And I had a friend actually just last week to mention, and she just sent me a spontaneous text. My PF is at about a 5.6 today. And so I understood the assignment, and so I reached out to her and was like, "Hey, you got some time to go, get some tea? I will pick you up. You don't have to meet me there." And, when we can do more of this for each other, I do think, and that speaks to one of your previous questions about, community and how we can do more, that we need to have a shared language, and then we need to know what to do when folks around us are struggling. And so I appreciate my family and my friends, and I am a tremendous person of faith. And so I try to be there most Sundays, or I'm virtual. I'm on Bedside Baptist. Getting what I need, from other places in order to keep me going. So it's an all hands on deck, and my music. And my son knows, if mom's in the car, because I go and sit in the car in the garage, and I turn my music up loud, and I just sit there, and I enjoy it. And I come out, and my son, he's 13. He's like, "Mom, you good?" "Yep, I'm good. I'm ready." And so, yeah, I use all of the things, whatever makes sense in the moment.
I love that you shared just so many different ways that you give back to yourself, and also that community support too, where your family, your friends are also contributing to your self care as well. I think that's such a great way to also kind of look at it. This was a question that I just thought of, but when you were talking about just like your week to week basis, what does your week to week look like? I know you're full time faculty. You probably do research. Yeah, what other things are you doing? Because I know as a psychologist, we get to do so much. And so I'm curious about, yeah, what are some of the things that you're doing in your professional life?
Yeah, having a PhD in clinical psychology and being a professor at a research intensive institution is great, because I feel like I have access to a lot of different worlds, and I can get bored easily. And so it's wonderful for me to have all these things that are interrelated. So I'm trained as a clinical psychologist, but for the last 21 years, I have been a university professor primarily at research intensive institutions. And so, what that means is I'm contributing to the science. When people hear about this study found, folks like me are doing those studies, where we're investigating, for me specifically, topics related to mental health for Black people, for other marginalized individuals, people who identify as second generation, who are dealing with cultural stress. So that's the work that I have been doing. In the classroom, I'm teaching, as an example, interventions. So I'm teaching and training the next generation of clinical psychologists, which I love, because I'm helping them with treatment planning. We're reviewing video, and that allows me to do the clinical work without being in sessions day to day or week to week with clients. Because I do, my heart goes out to the folks who are full-time clinicians. Those are the folks on the front lines. And that is tough work, especially post-COVID, because a lot of people are struggling post-COVID, and I don't even think people have a general sense of the level of struggle, the volume of struggle in our society. But then I'm engaging in wonderful podcasts, like this one, because we need more of these kinds of conversations. And I'm also thinking about, always the next book project. So book three, like I mentioned, will be out in a couple weeks. And so sometimes I'm doing promotion around, so what is this book about and how will it help people? I've done some work with the folks at Calm. So the Calm app, which is the number one sleep app in the US, maybe around the world, actually. So I've done some work with them, having produced my own series on Calm around, dealing with racism and discrimination, and then also being able to keep your peace at work. And so all of it, yeah, yeah. So all of it, has as this central thread, psychology, mental health, training the next generation, teaching. I haven't been able to teach my undergraduate class in a while, but I teach an undergraduate class in Black psychology for students who are interested in that topic. And we have a great time. So I get to do a lot of different fun and cool things that you talk about pouring out. Like, yeah, there's a lot of pouring out that happens. But fortunately, it's stuff that I love. I love it all.
That's so great. I love hearing that because I think when people think about psychology, sometimes they might think of it as this one dimensional. People just do therapy with people, but in all of the things that you just described, the presentations, the research, the supervision that you do, and then of course with the books and all of the other extracurricular things that you do, there's such a space in this field that I think is growing and ever evolving. And so I think it's just a really great time to be a mental health professional because especially as the stigma is kind of reducing a little bit, especially with the like with social media kind of exploding and people talking more about mental health. I think it's just great that you get to inspire so many people with the work that you do. So thank you so much for sharing that. Would you like to share anything else in terms of in terms of your work in Black mental health or research or just some of the exciting things that you're engaged in?
Well, there's probably two parts. One you mentioned already, and that is that I hope that people will continue to feel empowered. And everyone has to feel empowered in a way that makes the most sense for them because we all have our path, we all have our purpose. It's just a matter of tapping into it. For me, for folks who are just thinking about Black mental health in ways that are more intentional, it's part of why I wrote the Unapologetic Guide to Black Mental Health, for us to think about our strength, our culture, as Black people, as people of African ancestry, but also to be able to recognize that the stuff that happens outside of us, that ain't got nothing to do with us. And so we need to be able to parse other people's pathology from who we are. And so if folks who haven't read the book, I think it's worth taking a peek at it. And maybe for those who are in clinical care, or thinking about being in clinical care, and for folks who maybe aren't a part of the Black or African American community, be on the lookout for No Racial Elephants in the Therapy Room. It's actually already available for pre-order on Amazon.
Okay, that's awesome. I will definitely leave down those links below that people can check out. And I will also leave down a link below for your YouTube channel because that's also how I kind of found you in terms of just, you talking about mental health. And I was like, this is amazing. This is incredible. So I will definitely leave down a link below for all of those things that people can check out. Dr. Walker, this has been an unbelievable conversation. Thank you for this discussion. Thank you for your time here and sharing this space with us. It was such a truly great blessing for you to be here. So thank you so much.
Thank you, Phil. It's been fun talking to you.